So many people are looking to live happier, more stress-free lives. We provide interviews from mental health experts across various fields because we know finding quality information isn't always easy. Let's find more sanity together. Since COVID-19 has impacted our communities, many people have been worried about how this new lifestyle will impact children psychologically. Undoubtedly, parents and caregivers are stressed on how to best manage these times. Today, we have child and adolescent psychologist Dr. Robert Friedberg to discuss just that. Dr. Friedberg is a tenured full professor, head of the Pediatric Behavioral Healthcare Emphasis, and the director of the Center for Study and Treatment of Anxious Youth at Palo Alto University. He is a board-certified diplomat in cognitive behavioral therapy, a former extramural scholar at the Beck Institute, and a founding fellow of the Academy of Cognitive Therapy, to name a few of his associations. Beyond authoring numerous journal articles, he is the author of 11 books, including Clinical Practice of Cognitive Therapy with Children and Adolescents, CBT Express, Handbook of CBT for Pediatric Medical Conditions, and has another book coming out called Cognitive Behavioral Therapy with Youth, Traditions and Innovations. Now, on to the show. All right, Bob, thanks so much for coming on the show. I've actually was really excited for this interview because you can imagine how many people have been asking me about their children in this COVID situation.
Well, Jason, thanks for having me. It's a pleasure to be with you. Always a delight to talk. And, everyone's worried about this. This is, worry is natural. Once worry kind of becomes ratcheted up and accelerated into anxiety, that's when we have to worry about our mental health, but worrying is a normal phenomenon.
So before we just jumped into parenting, child stress, I just wanted to have people just listen to a little bit about what type of therapy do you do and why do you recommend that style of therapy and how it works?
Well, I do cognitive behavior therapy. And basically what that looks at is people's actions and thoughts and how they are productive or unproductive for them as a way to kind of help them get out of sort of the chain, some really rigid chains of behavior and emotional kind of chains, I guess is the best way to look at it, and to break those chains by asking themselves better questions, having a more productive private dialogue, and doing things that are more approach versus avoidance behaviors. Why do I do that? For kids, because it's the frontline treatment for just about all the things that kids present to psychologists, psychiatrists about depression, anxiety, OCD, trauma, behavior problems, etc.
And say that somebody were to come to you for CBT or any CBT therapist, what should they expect during treatment?
They should expect that the therapist has an approach that is very collaborative and that is guided by sort of measurement-based care, so that in CBT, we try to take the mystery out of therapy and make everything transparent, so that the collaboration is between you and between the family and the child and the therapist is sort of has there's an equilibrium of the power balance, so that while we are as cognitive therapists experts in anxiety or depression or whatever and its treatment, the child or the parent is the expert in how they are experiencing that. So that collaborative nature, that we all the things that we do, the fancy dancy techniques, are always done with the patient rather than to the patient. So they are actively partnering with us through the process, and that we are in a variety of ways measuring what works and what doesn't work. We stay with what works, and we try to make modifications in terms of when it's not working the way we would like it to be.
Yeah. And just in a nutshell, what would a cognitive technique versus a behavioral technique, particularly in kids?
A behavioral technique?
Yeah, versus a cognitive technique. So people are like, well, there's C and there's B. What do they look like?
So the behavioral techniques are the things you do, sort of the actions you take. So let's say that you're afraid of going outside these days, right? Even kind of opening up a window. So some people may be so anxious that they don't even want to open their window, right? Let alone take a few steps outside or go outside. So, a graduated behavioral task would be maybe just opening the window a crack, or opening your front door and taking a step or two out the front door. If you have a child who, let's say, is non-compliant with parent demands, a behavioral task would be setting up and most parents know about these type of things, setting up a star chart for when the child feeds, if their chore is to feed the dog, that when they complete that, they get a star or a point or something like that. That would be a behavioral task, something that they do, an action that they take. Cognitive task is looking at trying to re-engineer or reshape the problematic thoughts that go through your head. So, and when you're feeling different emotions, you have different types of these sort of private speeches that go through your head that are different. So if you're depressed, you're usually thinking that there's something negative about yourself, like I'm a loser, or I'm a failure, or I'm incompetent, or something like that, or other people don't like me, or the future is hopeless, those type of things. When you're anxious, you're more focused in on the threat and dangers in the world, and you're worrying that a danger is more probable than it is possible. And that's really the tricky thing about anxiety disorders or worries, is that most of the things that we get anxious or worry about are possible, but then we become really, really kind of derailed when we think that they become very, very probable, that they have a high degree of certainty of happening.
Yeah, and anxiety is huge right now with the current situation.
Absolutely. That all of those type of things, there is a danger out there. The danger is possible, but again, the way I like to talk to people about that is that the risk to any individual is relatively mild, but the consequence, the magnitude of the danger is high. So that's Absolutely. The thing that you have to keep in. It's kind of like teenagers having sex, unprotected sex. There is a certain possibility, but if that possibility comes through, the outcome is quite significant, right? So all it takes is that if you get the disease and you have an adverse effect, you don't really care about probabilities, right?
Yeah, absolutely, because the impact's so high. Yeah. And then, you addressed you addressed anxiety, and that's probably mostly what we're going to be talking about with this. But I was just wondering, two major things that we see a lot with patients, and particularly kids, is depression and anger. So what might be some sort of ways of thinking that would lead to kids to have depression or anger or concerns about their anger?
So now depression, as I mentioned before, has it's sort of a three cluster of cognitions, which are in negative view of the self. I'm bad, I'm a loser, I'm incompetent, I'm unlovable. So that's one, negative view of the self. A negative view of their experiences. No one likes me. My world sucks. Those type of things. And a negative view of the future. This is hopeless. Nothing's going to change. Nothing will work out for me. Anger is something different. Anger is a sense that what is accidental is misconstrued as being deliberate. So if somebody might accidentally wrong you, people who are more prone to anger will see that as being a deliberate action or a deliberate provocation. So you that you wanted to wrong me, couldn't possibly be by mistake. There's also a sense that people have when people are angry, they have very rigid rules and people break them. So nobody should tell me what to do. This might be my rule. And then when somebody tells me what to do, I get really, really furious and enraged about that. Another part of anger is that it ruptures people's sense of fairness. So that when things are unfair, right, you get angry. So a good example with a kid is that a parent imposes some sort of limit or demand or request on them. Please clean up your room, or please, you can only have an hour and a half of screen time. And the child goes, "Ma, that feels so unfair. It's so unfair." Right. Yeah. And it's not for kids, particularly younger kids and preteens, they confuse the notion of fair with what I want. Right. So it's really that it's not unfair. Yeah, that it's fair. But the real thing is that's not what I want. And then lastly, with anger is that people label others. They see their behavior as a personal characteristic. So that's where you have the name calling in anger. So you're a blank, right? That she's a blank or he's a blank, and they fill that in with whatever sort of negative label that they use.
Yeah. And, one thing that I love and what I think makes you a perfect child psychologist is that you're fun. You play with the kids, you're fun, you put on costumes, you put on masks. So for parents out there that say, well, my child doesn't want to do it, it's not going to be fun for them, it's going to be too hard. What would you say to those people?
If therapy is too hard?
Yeah, therapy, my kid's not going to want to do it. It's not going to, they don't want to do something that's not fun, that's going to be hard. And they're just saying no. They go once and they say, nope, I'm done with this.
Well, and again, Jason, you're also quite fun as well.
I try to
be. What would I say to them is they're right that, that it's very difficult for particularly a young child, a child who's not particularly loving going to therapy, to sit there and talk sort of traditionally to an adult about their problems. So what I always try to do, and the people that I work with, I encourage to do, is the more that a child thinks it's therapy, the less helpful it's going to be. So in some ways they have to almost think they're not in therapy. So we can deal, in therapy, we deal with very difficult issues, very, life trauma, very debilitating depression, really sort of being a prisoner of your OCD, those type of things. Those are serious issues, but you can deal with it in a lighthearted, fun way. Yeah.
Okay, great. And, want to jump into what probably everybody is coming onto this episode for, parenting and children during COVID-19. And I'm sure that in your work at your clinic and your supervision, this must be coming up all over the place.
Sure, because there are the stay-at-home orders that are affecting just about everybody, right? That everybody is working, many hours, being both a parent and whatever employee they are or self-employed that they are at home. So that makes it very, very difficult. So they're being kind of sort of burdened by those obligations is normal. But again, the expectations we put on ourselves as parents and caregivers can make that worse.
Oh yeah. So just so people know, I interviewed about 10 parents that I could talk to just to understand what parents' concerns are, because I myself I'm not a parent. What are people worried about? What are people thinking about? And two very big topics that came up were, how is this all going to impact my child's mental health? And how do I know if it is? And then also, how is it going to impact their development? So maybe we could talk about the mental health component, and then we could talk about fears on how different ways it might impact development.
Okay. this is the question that this is the answer that most parents don't like sometimes, which is it depends, right? So it's not an absolute certainty that all kids are going to be affected psychologically by this. There are many kids who are actually liking this, and they're home. Right? They're home, they're having fun, they're with their parents, and life is great in the pandemic. So those kids, we really don't have to worry about. We may have to worry about when they return to school and that transition, but during the shelter in place and being at home, there are many kids that are just, this is just dandy for them. Now, for ones that may be suffering, in addition, during the pandemic, there are a couple of things to watch out for. One is, what were they like before? So, is there a change in functioning in their daily living that's subsequent to the shelter in place and the quarantines and those type of things? The best place to look at that is, they're eating, they're sleeping, there's sort of routines, is there disruptions in those type of things? Are these kids who usually were kind of blithe spirits and running around, and now they're down? Are they social kids who've become very, very withdrawn? Those type of things. So a change from previous functioning now to what's going on in the world. And then the other part is, there are some kids, another proportion of kids who have, who kind of came into the pandemic already having psychological issues. And so therefore, are their conditions worsening? So kids who were depressed for whatever reason prior to this, and the depression is worsening, or anxious and their anxiety is worsening, or kids who have obsessive compulsive problems and they're checking, washing, those type of things, worrying about contamination has worsened. So you would see sort of an exacerbation or a worsening of previous vulnerabilities.
Okay. And, so Dr. Bob, might my kid be struggling and having a big mental health impact, but I'm just not seeing it? Could it be underneath just brewing and we're not going to know until it's too late?
Sure. But I think parents, again, have to trust themselves, right? That, if I were to read into that question just a bit with my Dr. Bob hat, Dr. Duncan, is that I would suspect that the parents are kind of worrying that they're missing something, right? And that that most parents, if you're really attuned to your child, will pick it up, right? Yeah, with those type of things. Sure, there are some cases where you're oblivious to it. But part of that is parents' anxiety about these unknowns, the uncertainty of everything. Yeah. Right. What should I be looking for, or whatever? The signs of a kid having a problem are going to be the same, that just the context is different. Right. So, this is a big environmental event, but you'd look for the same type of things if nothing was happening. Sort of changes in their habits, changes in their mood, worsening of things that used to be a problem, that you look at that type of thing.
And so for the kids that actually are struggling, what do you think the struggles that children are going to have, the percentage of them that actually are having a hard time?
And again, it's going to be, very individual to each child, right? For the kids who are more depressed, depressive prone, they're going to really be responding to the losses in their life, right? So friends, school, activities. Again, a lot of kids may, for example, for a kid who gets a lot of reinforcement or rewards from from being on an athletic team, the fact that they're not practicing or playing now is a loss of that. So that would not be surprising for a kid who takes a lot of pride in their social life. and has a lot of reinforcement there. Those they will. So it depends on what the child really sees as a reward or a source of reinforcement, and how much that has been lost. That may be sort of the biggest trigger for kids who are more depressive prone. For the anxious kids, they're going to be hyper vigilant or really watchful or alert to the dangers that are in the world, right? That the economic dangers. If mom and dad have lost income because of this, and there's that pressure. Certainly the germs, and fears of contamination would be there. Worries about, are they achieving enough to get into a college or those type of things, if school. So they're sort of looking at whatever threats kids would have. Separation anxiety, kids may worry their parents who go out to work may come back or get sick. Come back, get sick out in the world, or come back sick. So all of those are vulnerability factors for those type of kids. For kids who are more disruptive or have behavior problems, right? They're going to be much more They're going to be much more reactive to demands, to sort of rules, and those type of things.
So how do we help them cope with this? The kids that are impacted.
We being parents, or we being clinicians?
Yeah, I guess let's go with we being parents. And when is it time to then go to we being clinicians, finding a clinician?
Okay. So for parents, it depends on, again, how problematic the kid's behavior is. Let's say it's just a reaction and they're having some temporary, not enduring problem, and they're just anxious, depressed, angry as a natural consequence of what's going on in their lives. And how do you manage those sort of negative feelings? First is that as a parent, you want to accept the fact that these emotions are natural, right? There are no good or bad emotions. They're just emotions. And that learning to help the child tolerate that emotion, that negative emotional experiences are sort of part of life. We all love that. That's why we watch dramas or horror movies or go to a roller coaster, right? But when it comes to sort of feeling those emotions as an emotional reaction, we forget that we even gravitate to seeing a scary movie or riding a roller coaster to have that feeling. So you have to. Well, first part is to accept the fact that this is natural, is going to happen, and then to help them problem solve productive ways of managing whatever emotion they have. And then there are tons of really, really great parenting books that are out there, for the kids who are more disruptive. There's an awesome parenting book, and even has a video series that is on YouTube by Alan Kasdan called The Kasdan Method for Parenting Non-Compliant Defiant Children, right? And then you can get great tips from that, and you can read and see it. There's books for kids who are anxious called Freeing Your Child from Anxiety by Dr. Tamar Chansky, which is an awesome parenting book with handy topics. So you go to the parenting book shelf on Amazon or whatever your search engine is, and maybe get help that way. Then I guess we're moving now into when that's not enough.
Yeah. When
right?
should we seek help and get a therapist?
Again, when you try those type of things and you're not getting a whole lot of movement or relief from that, then you want to seek therapists. Most people nowadays, most clinicians are using telehealth platforms.
Yeah.
There are lots of great, therapist referral sites that you can use. You want to look for someone, I would just put in the plug that you want to look for someone who is skilled and trained in CBT, like you, that you can go to the Beck Institute for Cognitive Therapy and Research that has a Find Your Therapist screen or menu. You can go to the Association for Behavior and Cognitive Therapy, which has a Find Your Therapist. Lots of the state psychological associations have that. Look for that the person is trained and certified in CBT. That you can go to the American Psychological Association, the Academy of Child and Adolescent Psychiatry. All of them have directories where you can find a therapist. But you want to make sure that, I would say you want to make sure that your clinician is a cognitive behavior therapist.
Mm-hmm. And I think what comes down to a lot of what a lot of these parents were asking me were permanent effects. So one of the permanent effects they were saying, is all this environmental change and the social distancing and the fear of coming around other people going to have a negative impact on their kids' worldview? Is it going to fundamentally change them? And then also on the other part of that, is my child's development going to be delayed because of this socially, educationally? Even one parent brought up, everybody has a mask on. So is my child going to be able to read facial expressions since everybody has a mask on during their young development? So what's your thoughts on potential permanent change in our children because they're going through this?
Boy, what a great question. And again, that this all gets I'm not going to be glib about this, but it does sound glib about it, is that, so the answer to that question is, everything's going to change. But it's how you view the change, right? It's how you kind of mentally parcel the change. So this pandemic is going to change just about everything. If you see change as bad, it's going to make it worse. If you see change as perhaps being better or adaptive, then the change is not as scary. So that you can see this as an opportunity to do different things. So are we going to have a return to the way life was last fall? Probably not. Now, whether that's a good or bad thing depends on what you do and how you make sense of that. So again, like for example, the mask wearing, it's likely we're going to be wearing masks for a prolonged period of time. It's how you interpret the mask wearing, right? So one thing that I've been telling my supervisees is with kids who are afraid of masks or mask averse is superheroes wear masks all the time.
That is very
Batman
true.
Wears a mask. Right. So Spider-Man's face is completely covered with, a hood mask.
Yeah.
Can't even see his mouth. They like those characters. Right. And so how, can you tell how Spider-Man or Batman or any other masked hero can feel? Yeah. If you watch a cartoon, absolutely. So if you watch those Marvel Heroes cartoons, you can, you can see how they're feeling behind the mask. Will we permanently forever wear masks? Probably not. But we don't know. For the short term, people are going to be wearing masks. And again, if I can read into that question again about what might be behind that parent's question is they're worried. Again, it's that sense of uncertainty about how can I make this right? How can I control this uncontrollable situation, right? That we don't know, that we have to really be comfortable living now in the sense of unknown unknowns. And that takes a lot of, parents want the best for their kids. They love their kids. They want to protect their kids. And they feel uneasy. It's natural to feel uneasy about the fact that I don't know what to do with this. What do I tell my kid? What are we going to be wearing masks for the next 10 years? and how do I help make that work out for my child? I think what you have to do is take it day by day, help them understand what's going on in a way that is developmentally sensitive to them, and check your assumptions at the door about math. Remember, what's really kind of funny, I was watching on the news, they said years ago, you were not allowed to wear a mask, like if you went to a restaurant.
Oh,
because,
really? Wow.
Yeah, because, they thought you might be a robber.
Oh, well, fair enough.
Right?
Okay.
Because masks were, and I think we kind of have a cultural schema about masks, that they're, things that perhaps villains wear. So we're going to have to change that, right?
Yeah.
So that's another way in which cognitive therapy can be helpful. You asked the question about the development.
Yeah. A lot of parents are saying, I'm scared. My kids aren't socializing as much. They're not in school. I'm having a hard time getting them to do the work. Are my kids just going to be developmentally delayed because of everything that's going to be going on during the pandemic?
And again, this is one of the unknown unknowns. And it depends on what we do as parents and kids. And teachers and clinicians when you're involved with them. So, if kids don't do their homework, they're going to be delayed. But there are ways in which you have to help them do their homework. And that's where like things like the Kasdan method, it can be very, very helpful. And if that doesn't work, going to a clinician to kind of help them comply with homework. My guess is that kids who are not complying with homework generally had problems complying with homework prior to the pandemic. And it may be just exacerbated, or because the parent is home all the time, they're more aware of it and attending to it. So you would handle it the same way that you would handle if they were in school. Also, the other thing is that we don't know how long the social distancing is going to occur, or in what situations. So it's not going to be forever, but we don't know how long. It is time limited, but how time limited it is unknown. So we have to really kind of, once again, tolerate that uncertainty. The other thing to help parents is that kids have been on screens prior to the pandemic. That oftentimes their default option of socialization is on-screen relationships. Mm-hmm. So we do have Zoom. While it's not in person, we do have Zoom. We have FaceTime. We have all the different platforms. So that also is, it's not optimal, but kids have adapted.
Mm-hmm. And, I'm going to sound smart because I'm actually repeating something that you had told me during our pre-interview. But it sounds like, there could be some increased anxieties about certain things for a while, like, germs or things like that. Or there might be some, delays academically if you're having a hard time. But the idea is that it's not going to be potentially catastrophic delays. That even if they are, it's not going to ruin your child's entire life trajectory.
Right. And again, what all parents do, it's normal. They have catastrophic predictions and about ruination. Mm-hmm. This is going to mess up my child forever. Right. Kids are very, very, the younger the child is, the more flexible they are. And kids are adaptive and they are incredibly resilient. Mm-hmm. Our job is to mobilize that as individual parents, educators, clinicians.
Okay. And then any recommendations that you have about socialization and helping your kids keep up educational wise, just in case parents are concerned that that's not happening?
Well, I think so. For socialization, again, probably what you want to do is you reward the child for that. I think first, the number one thing is you want to find out what is getting in the way of them not doing the homework. Do they not understand it? Are they just not motivated to do it? Is there something better that's competing with their time in their mind? So you want to first find out what's the block to it, and then problem solve that block. And then once you try out a different problem solving strategy, and then reward the kid for socializing or doing his homework.
But the sense here is that if they are socializing over Zoom and you are doing a moderately good job of having them doing their schoolwork and being engaged, developmentally, they should track okay.
Yeah. And again, I think one thing that, as I probably should have mentioned is parents' expectations, right? That the more sort of demands you put on yourself as a parent, it's going to make this all a whole lot harder, right? So that what you have to do is try to check your expectations so that they're reasonable, right? So is your child's experience at home remote learning going to be identical to in class? That's an unreasonable expectation.
Absolutely.
So the question then it becomes, how can I accept the limitations of remote learning, if that's what it is, or my child not being able to go to Girl Scouts, soccer, camp, whatever? How do I accept that? And the limitations of that. Does that mean I'm a bad parent? So if my child is now not a kind of trap that parents get into is that, let's say your child's not doing their homework, and you try to coax them to do it. They don't do it. They kind of rebel against that, and immediately they say, "Gee, if I was a better parent, I could get my kid to do this." And that we place this equation of my worth being dependent on my child doing his homework, and making that equals my worth or my competence as a parent. That's a no-win proposition.
Yeah.
Right. Because you can't control anybody. Right. And so that just makes it worse. And then the more you feel incompetent, the more you try to control the parent, and then the more you try to control the child, and that makes the child rebel more. And as you've got a real never-ending cycle there.
Mm-hmm. And a lot of parents feel a lot of guilt that they're not doing enough for their kids. And I think it speaks right on to what you're talking about. I'm not doing enough. I should be able to do more. Or some parents are working full-time jobs and they have to kind of shoo their kids away constantly because they have to work, and their kids might not understand because they're used to, when mom or dad are home, I get to hang out with mom and dad, and it's this whole new world. What do you and it sounds like you touched on it, but any other advice on managing parent guilt about these things? Well, perfectionism is a big one. Mm-hmm. Right. That if I were a better parent, that I have to be all things at all times to everyone. Again, that's a very, very perfectionistic type, absolute type of view of things. And you want to look at parents need to give their kids and themselves a bit of a break during these times, and that you don't have to, you have to accept your imperfections, right? We're all diamonds in the rough, so to speak, from Aladdin, right? From Aladdin. Yep. And there's an advantage to, and again, kind of looking at, this is a metaphor that I do with parents and kids is Aladdin, right? What makes him a hero is he's a diamond in the rough. That's how come he got into the cave with where Jafar sent him. He's an imperfect person. So to accept the imperfections in ourselves and others really kind of does reduce the stress. And you mentioned it before, but I'll kind of bring it up a little bit more exaggerated. But I hear like a lot of parents and families are just getting very irritated one another. It's just too much time together and they're just at their wits' end. Any advice on how to help get the pot to boil less with everybody being stuck together so much?
And again, it depends on your living situation, right? If you're in a studio apartment with multiple people, multiple family members, it's more difficult than if you're in a large estate where there's lots of open spaces or private spaces. So you have to adapt that to your own living circumstances. But yeah, that essentially you have to have some me time, right? Or alone time, right? So that's the other end, as you said before, about you have the kid who's socializing and staying in his room or her room, playing games or whatever in their room, and they're not coming out or socializing or with the family or with other people. Then you have the other end of the spectrum you just said before, where everybody's on top of each other all the time. So balance is sort of the key thing. So that, for example, one thing that that's a good thing to use, whether you're sheltered or even when we're not sheltered, is that what I did with families sometimes who had this problem is we would create a box and put different activities in the box. Some of them were joint activities, like playing Monopoly together. Some of them were solitary activities, like reading a book in your room or wherever you're at. And then what they did is at separate times during the day, they would reach into the box, take the activity, and make a commitment to do whatever it is on that slip of paper. Interesting. All right. And then, and then what you do is the parents and kids come up with these and you put a variety of them in the box. So you never know it's like a grab bag. But aren't I a terrible parent if I take me time? Like, shouldn't I dedicate all my time to being with my kids? Isn't that just being selfish? That, no, if you have a parent or if you are a parent and you have that private thought go through your head, right? One of the things that you would have to say is you'd ask yourself some questions, right? So one question would be, what do I do? So again, let's just articulate that thought that it's, unless I spend 100% of my time with my child, I'm a bad parent, right? So what you then might want to do is what we call in cognitive therapy, it's called a test of evidence. And so you say, what is it that convinces me I'm a bad parent? What is it that makes me doubt I'm a bad parent? And you ask yourself a series of those type of questions and compare the answer to that. Another way to look at it from that test of evidence perspective is to say, what do I do that a bad parent would never do? And what does a bad parent do that I would never do? So you essentially kind of parcel out and really kind of deconstruct what you mean by being a bad parent. And also I think of, well, how might taking some me time make me a better parent? If you're coping better, you're feeling better, you're having your own time to do your own hobbies and you're happier, in all likelihood, you're going to be able to parent better and tolerate your frustration. Kids can get you frustrated, being able to tolerate that better. Yeah, absolutely. Great idea. Yeah. Regarding communication, and you had brought this up earlier, how do we talk about this with our kids? What should we tell them? What should we not tell them? And are we going to traumatize them by letting them know too much about what's going on? That you never traumatize a kid by telling them too much, right? It's how you tell them, right? So you just want to be straight with them. So again, for example, what you don't want to do, so sometimes, this is an example from kids who have to go to the doctor and they're afraid to go to the doctor and they're going to get a shot. They're going to get a flu shot or some other shot. And they say it's not going to hurt. That the child doesn't want to go because it hurts. Mm-hmm. They're afraid that they're going to get hurt by the shot. And the parent says it's not going to hurt. That is not going to be, that's not helpful because it hurts.
And then you're right? A liar.
Yeah. So you want to be transparent, you want to be transparent and honest. And so the example to that is, yeah, it is going to sting, but it's only going to sting for a couple seconds or a minute, or your arm's only going to be sore for an hour, whatever it is. So using that kind of sort of standard. So we should tell kids that, yeah, there's a bad bug out there. Yeah. In words, you're going to vary the language depending on the kid's developmental level. But yeah, there's a bad bug out there. We're doing things in our house to keep us all healthy. And they are washing our hands, wearing a mask, blah, 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 right? Covering your mouth when you sneeze. All the things that you hear on TV and elsewhere. And those are the things that are going to try to keep us safe. We're going to have to do that for, the near future. But eventually, we're all going to be able to go outside, either wearing a mask or, we're going to get a vaccine or whatever.
And one question I got is, how do we know for sure that our kids are understanding how to do the right thing, how to do the safe things and wear the PPE? When can we be comfortable to know that they get it?
When you say get it, what do you mean?
Like understand that they need to stay away from other people. They have to wear their mask, that they have to wash their hands without touching their face. How can we feel confidence that our kids actually understand what we're teaching them?
And again, this is just really interesting type. That's again a really fascinating question. That parents do this all the time. This isn't a new skill for a parent. It's just because this is all so new for everybody, right? That they think that you have to come up with some new parenting skill. How do you know that? Almost every parent that probably you've talked to or that's listening right now has helped a kid be potty trained. So how do you know that, after they've done that when they go to school, that they're peeing in the potty or pooping in the potty
or crossing the road, which is a potential health risk.
Right. Looking both ways, all those type of things. How do you know parents have had kids, wash up for dinner. Right. How many parents say it's the same type of thing? So it's cold outside, wear your hat, put your hood on, all of those type of things. So it's the same as any of those other things that parents have already been doing. Now with masks, it's like tying your shoes, right? So all parents have taught their kids how to tie their shoes. Right. So how to put on the mask, you teach them how to do it. They pick it up, when whatever time they pick it up. And then with practice, they get better at it. So they tie their shoes at school without parent involvement.
And this is a little bit older, but people are scared. Can I trust my older kids that are old enough to go out without me to do the right thing, to be safe? How do I know that they're going to be safe? Should I give them that freedom, or should I just keep them with me at all times?
And again, another great question, Jason. If I had, again, to all the parents out there that are listening, then I would say, well, how do you know that? So you have a teenager, right? And they go out with their friends driving a car, to a party. How do you know that they don't jump in a car with somebody who's been drinking? How do you know whether they're having unprotected sex? How do you know that they're not taking substances wherever they're at? When the kids get on the bus, right? How do you know they actually go to school? It's the same process. So there is that that you have to trust the child, right? There's an awesome book by one of your local neighbors, Jess Shatkin at NYU Langone, on why kids take risks, and particularly for parents with adolescents. It is a fabulous, fabulous book. And one of the interesting things from that book that he talks about is that actually teenagers are more worried about risks that they experience than the parents are.
Interesting.
Yeah.
I mean, that's a really interesting fact, because in our society, we often assume the flip. Right.
That, what Jess talks about is that when alone, teens worry about the risks of everything much more than their parents do. However, when they are in a group, there's a contagion effect, and they engage in more risky behavior. So that book is just a really, really great parenting tip book, and it's just a fascinating read.
So basically, it sounds like what you're saying is that the strategies are the same, and it's a lot of strategies parents have already been doing across the board. It's just a new problem. And if you just look at it as just another problem, that you'll be able to figure out all the good things you've done before with your kids and just use them in this situation.
Absolutely. And again, so that, whether the kids keep social distance is just another form of what are they doing when they're not in my eyesight.
And should I hide if I'm scared about this? Is it okay for my kids to see that I'm scared about my finances, about me getting sick, about them getting sick, and about the future of our country and the world?
And again, here's another one of these depends. It depends on how in control you as a parent are of those worries. So if you scare the child with your worries, or burden them with them, or ask them to take care of you, then it's not a good idea to share that. But I think you want to share things with a child depending on their age and what the content of what you're afraid of, and in a way that appreciates their, again, development and circumstance. So it's naturally going to share more with an adolescent than you are with a toddler. You certainly don't want to panic and terrify a child based on your worries. However, it certainly would be reasonable to have, so mom, can I buy this on Amazon? And your expenses are or your income is less because of your current employment situation. And you say, well, dad and I are not bringing in as much money, so we really have to worry that we want to keep our costs down. Explaining that in sort of a matter-of-fact way would certainly be reasonable, versus saying, well, we're in a terrible situation. This is awful. Nothing's going to happen. We're in extreme danger. And, you're just making things worse by asking for a toy. That's probably not helpful.
Got it. With the rest of our time, I wanted to jump over to the new research that you're doing, because I think it's completely fascinating on uncertainty tolerance. And it might be new, but it's something that you're going to be working on now. So just to start, why is uncertainty a problem, and why do we potentially need more tolerance for it?
That what we know about anxiety is and you've mentioned it a couple times, is there are certain things that are sort of pathways to making you vulnerable to anxiety and making whatever anxiety you have worse. One is catastrophizing, right? Thinking the worst is likely. Then there is the notion of that things must be certain. I have to know what's going to happen, when, to whom, where, always, right? That inability to tolerate any sort of uncertainty and having things not have a inch or a speck of doubt to them is impossible. But if you believe that that's your rule for living, that makes anxiety worse or more likely. And last is the sense of control is fundamental to all the anxiety, or perceptions of lack of control is fundamental to all forms of anxiety. So whenever we have a sense of being out of control, that makes us very, very uneasy and uncomfortable. And if you think about our current situation, right, we're uncertain. I mean, even the experts are uncertain. Mm-hmm. So that makes everybody anxious, that we don't have control over much about this. Unless we're in governmental power, we don't know when things are going to open up or not. We're certainly not in, as people talk about the virus, they say, that the virus is the one in control. The virus makes the decisions. Yeah. So all of those things kind of make, if you're prone to being uncomfortable in uncertain, uncontrollable situations where you catastrophize if you can't, that makes the situation much worse.
Mm-hmm. And so what are you guys looking at for increasing uncertainty tolerance? Tolerance, sorry.
Say that again, Jason.
Yeah. So what are you guys looking at in your efforts to increase uncertainty tolerance?
Well, one of the things I think that what is a classic CBT intervention is to looking at what things are you certain about, what things are you uncertain about, how much can you control either of them, and then how do you tolerate, what problem solving strategies can you use to tolerate that level of lack of control or lack of certainty. It's kind of like, a good example is that, this from your work, is that patients who have obsessive compulsive disorder ask for a lot of reassurance.
Yes.
Right. And so doubt, that another way of saying uncertainty is doubt. Right. So doubt is really fundamental in obsessive compulsive disorders. So did I check, is this locked? Right. Is this contaminated? Is this food safe? Is this surface clean? Right. And then there's the compulsive washing to make certain what is doubted. Right. So it's the same type of thing that we do with people who are, who have OCD, and that doubt about that is, did I check? Well, how many times did you check? I checked twice. Well, okay. Was it locked? Yeah. All right. Then how do you sit with the fact that, okay, twice is enough? And
with the situation that we're in now with COVID, I mean, there's so much uncertainty. So it sounds like uncertainty tolerance would be part of the bedrock for coping.
Absolutely. Right. It's that's one of the reasons. And again, it's one of the reasons why we're just so fascinated by that concept, which is, how that we're actually we haven't started yet, but we're going to be launching our study looking at both kids and parents' tolerance for uncertainty. Right. And that the more the parent can tolerate uncertainty, likely the more that's going to model uncertainty tolerance for the kid.
Got it. Okay. And if people want to keep track of this study, do you have any way for them to look at it, or has that part not been set up yet?
That part has not been set up, but okay. I think probably if my students are listening to this, we're probably going to update our website so people could take and that'll get publicized.
Okay. And I'll update the show notes. Once you have it, I could attach it to the show. And, we had talked about resources, and you gracefully, and I'm grateful that you sent me several, which I'm also going to include in the show notes. You mentioned a few of them during the show as we were talking, but is there any other resources that you think would be noteworthy for people to know about?
Well, I think that I did mention the Tamar Chansky book, which is great. There's also for teens, for parents who have teens who might be anxious and want a self-help book for them. Michael Thompson and Catherine Martinez have a great book called My Anxious Mind.
Okay.
Which if you go on Amazon, you can get that. And it's a self-help book for teens. Mentioned a couple of the websites. We did at Palo Alto University a webinar on worry versus normal anxiety, which if you go to our website, you can get that and watch that webinar for free.
Great.
Mentioned the Beck Institute and the Association of Behavior and Cognitive Therapy, American Psychological Association, all of those things.
Okay, great. So we have resources here both for self-help, some webinars, and then also resources to find more information and potentially find a therapist through those websites as well. And that will all be included in the notes.
Great. Awesome.
Great. All right. Well, thanks so much, Bob, for doing the show. Parents were really looking forward to having an expert that could talk on this because they had so many questions. And I think that your answers were spot on, and it's going to be beyond helpful for so many people.
Well, I really appreciate the opportunity, both to kind of help folks as well as to see you and talk with you. You know how much I like you.
So hopefully in the future, as the show goes on, if there's other topics around children and parenting, would love to have you back.
Great. Happy to do so.